Sharon Wilson, go ahead.
All right, thank you so much, Mon and Ari. And I'd just like to say welcome, welcome, welcome to our Tuesday night Health and Wellness Zoom. I am super excited, guys. You all just don't have a clue how excited I am tonight for each and every one of you who have joined us. And thank you, first of all of our guests for being men and women of your word and showing up. So that I'm so grateful for. And definitely we're gonna honor our Bishop Paul Fortson, who is in Atlanta, and he is on the call, and I'm just excited about that. So thank you. And if we have any other pastors, because I contacted so many pastors, I said, look, you need to be on this call because you have congregants who are dealing with issues and they need to hear this message tonight. So thank you once again for being on. And so at this time, we're grateful for our leaders, and I just want our leaders to kind of put their hands up to let everyone know who they are. We're calling from all over the US, and we may have some, sometime from the Philippines. We have others, we have South Africa. I'm looking for them to be on tonight. So we're just excited that this message is going to get out worldwide. Okay, so thank you so much. And so all of our Spanish brothers and sisters that have joined us tonight, we so appreciate you as well. So at this time, we're going to do our disclaimer. Okay, so we're not here to diagnose any medical problems. However, this site is for informational or educational purposes only and does not substitute professional medical advice and consultation with healthcare professionals. And so just saying that, we just want you to know that we're here to better our health, to get knowledge about what we need to do. And we have some of the best products out there that helps build our immune system. And so what I'm gonna do real quick before we get started, I'm just looking around. Let's just do our commercial so we can get some information, okay? Just hold on. And hopefully I could get to it. Hold on. Okay, here we go. Can you see my screen?
Yes.
Yes.
Okay, great. All right.
Atomy Hemohymns, birth behind the scenes. Are you curious? From now on, we will tell you in detail. Atomy Hemohym was born in Korea Atomic Energy Research Institute. A total of 50 billion won was spent on research. Biotechnology researchers participated. Angelica, Snidium, Peony. To discover these three combinations and find the optimal ratio took 8 years. In 2006, it was finally recognized as the #1 raw material that can aid in improving immune function. Atomy Hemohym was born in this way. After a long period of research, it was created with a taste that's easy for everyone to consume. At first, Hemohym had a hard time attracting many people. At that time, Atomy appeared and started selling 30 pouches for 70,000 won. And each time the profit increased, the number of pouches increased to 48, 54, and now 60. In addition, the price has been lowered to 1/10 of the original price. Thanks to that, more consumers wanted to purchase Atomy Hemohym, and now it stands tall as Atomy Hemohym. What kind of legacy will Hemohym continue to create in the future? Only for immunity. Atomy Hemohym. Birth behind the scenes. Are you curious?
All right. So for those of you all that don't know a little bit about our Atomy products, towards the end, Uncle Mike's going to come and explain a little bit more about the products that we have. But at this time, we want to take a minute and I want to introduce this young lady. And you all have seen her on the screen. Her name is Shyra Cotton. She is a certified physician assistant at Cardiovascular Solution at Central Mississippi. She was born and raised in Cleveland, Mississippi, and she attended Eastside High School and graduated valedictorian of her class in 2013. And she attended the University of Southern Mississippi on a basketball scholarship. She graduated from USM with honors in 2017. And she received her Master's of Medicine Physician's Assistant degree from Mississippi College in 2020. And I'm so excited. I've had the opportunity to talk with her and just spend some time on the phone. And she is a powerful individual who works alongside of Dr. Foluso Fakorede. Please tell me I said that right, because I've been practicing.
Fakorede, close, got it.
Okay, all right. And so I'm just really blessed. She's just such a beautiful individual. And so she is coming at this time, and we're going to turn it over to her. So let's give her a warm welcome. Now, she's in Mississippi. She's a home girl, and so we're excited. So I know Mississippi ought to be excited. So let's give her some love as she comes. Take it away.
All right. Good afternoon, or good evening, everyone. I'm Shyra, Dr. Fakorede's PA. Tonight, we're going to be talking about peripheral arterial disease, or PAD, as we like to say it. So I'm going to share my screen, and we're going to do just a brief introductory video of Dr. Fakorede and his mission for our practice. Let's see here. Desktop share. Okay. So that's the PowerPoint. So I'll just kind of go through this video just briefly. Let me know if you guys can hear it correctly.
Over the past 3 years, we have had an interesting outcome in terms of raising awareness and talking to people at the level in which they can understand it from both an educational standpoint, clinical standpoint, but scientific standpoint.
We started realizing that we had to go out to the people. If you don't know you have a health problem, you're not going to seek out care. If you think your leg pain is due to arthritis, you're not going to seek out a second opinion or more treatment. So Dr. Fakorede realized that if you go to the churches, you can get people. Everybody goes to church. And we live in the Bible Belt, and that is the focal point, that is the drawing point for everybody.
Good morning. Good morning. Please stand and help me welcome our newest ambassador, health ambassador of the Mississippi Delta, Dr. Foluso Fakorede.
Good morning, family. Good morning, everybody. How y'all doing? Good. Thank you. Just want to start off by thanking everyone for bracing the elements of the weather today to come out to listen to this important message. I've decided to target faith-based organizations because in the faith-based setting, majority of all stakeholders, when it comes to it being a provider, it being a family member, it being a politician, or a community activist, all show up in the same setting at the same time, and they can understand what the risk factors are, what the treatment should be, when to seek a second opinion if you're told about an amputation, and who the best physicians or providers that will be able to treat the conditions.
All righty. So that's just a brief introduction on how he sees PAD and how we kind of attack it as an organization. So I'll begin my presentation. Everyone can see my screen, right? Yes. Okay.
Yes.
Good. So again, we'll be talking about peripheral arterial disease. And so our organization is Cardiovascular Solutions of Central Mississippi, as well as Fusion Vascular, two different organizations that I'll discuss. Here's a picture of our group. To my left over here, I have Clifton Reed, who's a nurse practitioner, Carly Andrews, who's also a nurse practitioner, Dr. Fakorede himself, myself, a PA, and then Simon Burnham, who's the director of the lab. And I will send this link if you guys need it at the end of the discussion. You can go to padadvocate.com and get more information on PAD there. So what is PAD? It's a circulatory deficiency that's prevalent among the aging US. An estimated 21 million Americans have it, and this number has grown since 2020 significantly. So it's basically the buildup of plaque in the arteries. Now, PAD is arteries outside of the heart. So the heart has its own arterial system. PAD is any artery outside the heart that has disease. So that could be in the brain, that could be in the upper extremity of the arms, that can also be in the lower extremity. Now, for this talk, we will be discussing PAD in the lower extremity, which is what we focus on mainly in our practice. Oh, let's see here. Okay, there we go. So the prevalence of PAD is extremely high. If you look at Alzheimer's, stroke, cancer, coronary heart disease, 19.1 million people, again, that's a very low estimate. It's 21 million people or greater have PAD, and that's just under diabetes. So it's very, very, very common. PAD awareness is also very low. Only 26% of people are aware of what PAD is or have ever heard of it, compared to 67 versus 74% of people who know about coronary artery disease and stroke. So it's very prevalent, it's very costly, and it's very deadly. If we look at a 5-year mortality rate versus prostate cancer, breast cancer, 30% of patients who have PAD are dead after 5 years. And if you take it to the end stage of PAD, which is critical limb ischemia, we'll talk about that a little bit later, 61% of people who have critical limb ischemia also die within 5 years. And that's higher than stroke and colorectal cancer. So we talk about the co-prevalence of PAD. It's extremely high with coronary artery disease. And again, that's arterial disease around the heart. So 80% of people who have CAD also have PAD. So when we look at screening, we want to screen those people who've had a history of heart attack because they're more likely to have PAD as well, and vice versa. So how do we acknowledge this? Excuse me. So how do these patients present? 15% of patients present with claudication, typical textbook claudication. So what claudication is pain with walking that is relieved by rest. That pain can be classified as cramping, as aching, numbness, tingling. And then we look at 50% of people who do not have any symptoms at all. So this is very significant, 50% of people with no symptoms at all. And then 33% of people actually have atypical symptoms. So these are symptoms that are not taught in medical schools. So a lot of our patients, especially in the Delta, they'll present with what we call atypical pain. So they'll say their leg gives out, their legs feel heavy, their legs are cramping, things that you wouldn't typically contribute to claudication. And so they need to be screened as well. Not all leg pain is PAD, so that must be stated. Spinal disease can cause radiculopathy, which can cause leg pain. Peripheral neuropathy, especially from diabetes. Osteoarthritis of the hip and of the knee can also cause leg pain, again with muscle spasms, cramps, restless leg syndrome, and venous disease. So we look at the risk factors. So patients over the age of 50 are at 2 to 3 times risk for PAD. Patients with smoking and diabetes, 2 to 5 times and 2 to 4 times. So smoking and diabetes is one of the most common risk factors that are associated with PAD. Again, you have hypertension, high cholesterol, chronic kidney disease, and being of the African American race also puts you at 2 times risk for PAD. So how does diabetes impact PAD? Patients who have diabetes are more likely to present with ischemia. They're more likely to have ulcers or gangrene. patients with, sorry, that's my toddler, he's trying to get to me. Critical limb ischemia also develops really quickly in patients who have diabetes. So we'll talk about that in this next picture. Patients who have diabetes are also more likely to have amputations, 28 times more likely to have amputation. So I hope you guys have digested your supper because here's a couple pictures of what we call critical limb ischemia, which is the end stage of PAD. This is PAD that has not been treated. So here's a couple pictures of patients who have gangrenous changes and ulcers of the leg. So if we look at the toes here, you can see that the toes are black, they're cut off. You can look at ulcers here. And unfortunately, all of these patients required an amputation, which could have been prevented if they had what we have, if they have had the proper physical exam. So in our clinic, what we do is we have all of our patients take off their shoes. We want to look at their feet to see if they have any wounds or ulcers. We know diabetics, they have neuropathy. So a lot of times they're unaware of wounds on the bottom of their foot. So that's our nurse practitioner, Clifton, and our doctor, Dr. Fakorede, and one of our patients. Unfortunately, major amputations are usually the first treatment for people who have wounds, unfortunately. So not a lot of people are aware that there's something called an angiogram that they can have done before they have an amputation. So 51 to 73% of people who have major amputations had no angiogram. No angiogram also means no revascularization. And I'll talk about what an angiogram is shortly. So this is Dr. Fakorede and I. We're doing a procedure on a patient, an angiogram. And so basically what an angiogram is, it is a procedure where we put a little IV in your hip. Through that IV, we shoot dye down your legs. And I'll have that in another picture after this slide. Once we see the arteries under the dye, we can tell if you have blockages. And if you do, we go ahead and fix it through that little IV using our tools. And in my hand, you can see a little laser, which is one of the most common techniques we use to remove plaque. The procedure takes about an hour and a half to 2 hours. And then you recover for 2 hours after, go home same day. Very simple procedure. Let's see here. Okay, and so this is what we're looking at when I say an angiogram. So if you look here, you can see that there's black, okay? There's black on white. The dye shows up black when we shoot your arteries, okay? So in this picture, you can see that there's no black going straight down that leg. Over here, you can see that black. So this is a blockage. This is a 100% blockage of one of the main arteries of the upper thigh. And here's the bottom of that blockage. So this is what we do. We open that blockage so that there's blood flow going down that leg. It increases blood flow, increases wound healing if it has more blood flow. And so that's what we do. And that's basically what an angiogram is. Again, most of our patients are unaware of what an angiogram is. So there's multiple treatment options for a PAD. You don't have to go straight to amputation. You actually don't even have to do an angiogram first. So the number one thing we tell our patients is lifestyle changes. So if a patient smokes, we want them to quit smoking because smoking increases the risk of amputation by leaps and bounds. So we lower blood pressure. Again, that's a risk factor. We lower cholesterol, that's a risk factor. All this through diet and exercise. Lowering diabetes, A1C numbers, that also reduces the rate at which plaque can grow. A healthy diet, and then we recommend exercise. You can do a modified exercise stress exercise trial, where basically you just walk until you have claudication, you rest for a second, and then you continue to walk. And so you're trying to push through that claudication. With medications, we use we use aspirin and Plavix to prevent clot formation. We use statins to lower cholesterol. We use antihypertensives like losartan and lisinopril to reduce high blood pressure. A1Cs, we usually let primary care manage the diabetes. If it's more severe with an A1C greater than 9, we usually refer to an endocrinologist. And so there's also a medication that helps prevent claudication symptoms. It does nothing else, but just helps prevent those symptoms. It's called cilostazol. And a lot of our patients are on that as well. And then you get to revascularization, which is what Dr. Fakorede and myself do. The angioplasty, which is just ballooning of the artery. If that doesn't work, we can stent that artery. And if all else fails, there's vascular bypass surgery. Basically, a surgeon, it's an entire surgery. You're under anesthesia. They take a graft vein and they hook it from wherever the blockage is to wherever it stops. And so that's pretty cool to see as well. And so in the Mississippi Delta, I know that was on our little pamphlet that was given out. We have reduced amputation rates by 87.5%. And so this is kind of a base model for what needs to be implemented in many places in the South, because that, like we said, that Bible Belt, diabetes belt is all the same. Patients are at risk for amputations there. And so, like I said, we reduced those rates by 87.5%. And here's just a graft. Dr. Fakorede came into Cleveland, Mississippi in 2015. 2014, there were 0 angiograms being performed, 56 amputations, of 560 amputations that year. Again, in 2015, he was just starting up, 73 angiograms, 200 amputations that year. So it reduced dramatically. And then as you can see, as the years go on, those amputation rates continue to decrease with increase of angiograms. And so why we want to avoid these amputations? 60 to 80% of amputees cannot walk. And this is because they cannot afford prosthesis. A lot of the people who undergo amputations are poor. So insurance doesn't really even cover prosthesis in the state of Mississippi. You significantly reduce the quality of life. No prosthesis, no walking. I mean, that's no life to live, right? And then there's a high in-hospital mortality rate. So 10% of people who have below the knee amputations die in the hospital. They don't even get to go home. 20% of above the knee amputations, same thing. They die in the hospital. And then majority of patients, they never get to go home. They're stuck in long-term care facilities, nursing homes, and Medicare only covers the first 100 days of a nursing home. So, I mean, that's no life to live. This is why we want to avoid amputations at all costs. Patients who have amputations are also, their likelihood of dying in the next 5 years is about 80%. And so this is a patient. So now we're just going to go through some stories. So this is a patient. He came in. This is a critical foot. It's red. It was ice cold. It was kind of hard and woody, very painful to even touch the skin. He came in. He was supposed to get amputated that day, but he came into our office and asking for help. And we took him into the lab. And so this is what we see. There's no blood flow, none. From the top thigh artery, there's none. Okay, so we actually did the procedure. We got him open. He ended up having to go to the hospital because he was throwing clots for whatever reason. And so in order to keep this open, they had to take him in the hospital and give him what we call thrombolytics or clot busters overnight. And this was 8:14 p.m. the next day. Look at that foot. It's alive. It's well. And he still has that foot to this day. And so I talked about our poor people, which is unfortunately a lot of the South and a lot of Mississippi. We talked about social determinants of health and how that can affect overall healthcare. So a lot of people think that, you know, if we just throw insurance, if they have healthcare coverage, we have programs for them to attend, this covers it all. But no, that's only 20% of the problem or the tip of the iceberg. So with these patients, we have to address all of the social determinants of health. This is education, food, what neighborhood they live in. Because I mean, if you're in an unsafe neighborhood and I tell you to go home and exercise, where are you gonna go? There are no sidewalks. We talk about employment, income. If I give you a prescription for an expensive medicine, you can't take it because you can't afford it. And so on and so forth with food and diabetes. I see this all the time. We call it food deserts. Actually, they're food swamps. If you go to the smaller towns in the Mississippi Delta, I can count, there's no Whole Foods. All you see is Burger King, McDonald's, Wendy's. We have a Dodger's chicken, which is famous. So, I mean, this is what our people have, and that affects their health overall. And so what our mission is we do community engagement to raise awareness. Because again, like Dr. Fakorede said, patients, they don't know what they don't know. So our job is to go out and teach, enlighten, and try to help save some limbs. So this is where our advanced practitioners play a role, our lab techs, our nurses, who help sedate our patients, make sure they're comfortable during the procedures, our staff who make sure their insurance are up to par and that they can afford what we're doing for them. So lastly, I'll discuss Mr. Otha Rucker, okay? He's a 67-year-old male who presented to us with a wound, non-healing wound to his second toe. It lasted for about 6 weeks. He was seen in an outside wound care facility. He had no vascular workup, so no one had ever taken a look at his arteries. So he had a past medical history of diabetes, hyperlipidemia, which is high cholesterol, hypertension, which is high blood pressure, and former tobacco use. He actually quit, which is good. So he was a former truck driver. He couldn't, because there was a bill in 2005 that was passed. If you were a truck driver and you were on insulin, you were disqualified for truck driving. So he had about 5 kids, 3 grandchildren, 1 great-grandchild. He lived alone. He had a 4th grade reading level, so he was pretty much unaware to what his options were, basically whatever the doctor told him. His A1C was 11.3, which is extremely high, but he was working to get that down. So these are his pictures, his angiograms. So we did it before. So here you can see a blockage right there. There's 100% short occlusion right there. He had a blockage here, and then he had what we call ischemia here. So this artery was fairly small. It's almost like a hairpin. So this is after we opened him up, we fixed that blockage there, and that artery actually pumped up. So this is Mr. Rucker a week after this procedure in our office. As you can see, he had amazing blood flow to his foot. He had 1 toe that needed to be amputated, and this is Mr. Rucker a week after.
Doctor, send me over to the wound center to get the toe implanted.
Just the toe. Remember, we restored blood flow to the leg.
There you go.
So what happened?
So once I get over there to the so
Right.
and then I told the doctor had said, Mr. Rucker, you're gonna be an outpatient surgeon.
Correct.
They're gonna clip the toe, ain't gonna take no more 2 stitches, you going back up.
Right. So he told you they're gonna clip the toe, 2 stitches, that's it.
That's it.
Then what happened? You woke up and your whole leg was chopped off?
Man, don't you know it.
Is that what happened?
That's what happened. See, he pulled all the scab off the toe. He wouldn't let the toe heal.
So this is what the toe looked like.
And so this is just a quote by Dr. Martin Luther King: "Morality cannot be legislated, but behavior can be regulated. Judicial decrees may not change the heart, but they can restrain the heartless." And so Dr. Fakorede has actually been working on an act with Congressman Donald Payne, who's a congressman in New Jersey, to help hold these people accountable for things like this when they happen. It helps cover the coverage of prevention strategies, PAD screening tests. And so they've been working on this for quite some time. We actually have a meeting with Congress April 26th in Washington, D.C. So I think we're making some leeway on this. And again, this is his article. So he advises anyone who has any questions or wants to know more about PAD. It's titled "The Black American Amputation Epidemic." It can be found on the website. And if you Google that article, it can also be found. And that is the end of my presentation. I think I may have gone over a little bit, but that's all.
Oh my God, thank you so much for that information. And whew, that was so touching, guys. That was so touching. So that's what's been going on here in Mississippi. and that has been a concern. So I'm just grateful. I want to make mention of the lady that introduced me to their clinic was Dr. Betty Mayfield. And I'm going to ask her to come and take a minute and just kind of share, and then we're going to open it up for questions, because she was the one that introduced me to their clinic. And also my brother was the one that talked to me about Dr. Fakorede, because he went to a clinic of one of his partners in Atlanta, and he was able to see them and, just really get help and information. So Dr. Betty, can you just come on for a minute and just share your testimony, maybe about your sister? Go ahead and unmute. Okay. All right. So maybe she's tied up right now. But are there any questions? If you have questions, go ahead and hit the raise hand button and it'll take you to the top.
I've unmuted, I'm sorry.
Okay, go ahead.
Hi, good afternoon, everyone.
Good afternoon.
My name is Dr. Betty S. Mayfield. I'm from Mississippi. I've been in the Atlanta area for about 39 years now, but it was such a blessing, I guess. I was home.
Hello.
With my older sister. Hello, can you hear me?
Yes, we can hear you. Yeah.
I was home with one of my older sisters, and about I guess Lily Noel, is Miss Shyra still on? Hi, Miss Shyra, how you doing? First of all, and I want to thank you for that presentation,
Yes,
and
ma'am.
just for sharing with us and for being here. First of all, let me just back up a minute and just thank you for just giving us all of this great knowledge that we're going to take out to our people. So they told my sister she had one toe that it was black, and then eventually her whole foot became, it was black, and it was kind of like coming up the leg. So the doctor told her that she probably would have to amputate her foot. And so what we decided to do, it was 7 girls of us, so we started to research. And so Dr. Fakorede, I saw him on CBS. I was here in Atlanta. One sister read about him in Reader's Digest. We didn't know we were reading about the same doctor. And then we talked to the older sister, come to find out that was her husband's doctor. And so I was able to take my sister, I just drove her to Cleveland because it was time for her checkup. And I was able to go in the room, and I started talking to Dr. Fakorede, and I told him I was very interested in being an advocate back in Atlanta where I live. And I wanted to take it and share it with my bishop, who I believe is on tonight, Bishop Forson. Good afternoon. And so I wanted to take it back to my church and to my bishop. And so Mr. Virgil, who is Miss Wilson's brother, we are friends, and his family and I. And so there were some things that he wanted to get checked out. So Dr. Fakorede recommended me to Dr. Alabi at Emory University, who also who also is an advocate for PAD. And so she goes around to the churches here. And so when I went to her, she said that she would be able to come to our church or any church that needed us, just like Dr. Fakorede's have his group and organization. All of them really from state to state work with each other. So I was able to, through Mr. Virgil, meet Ms. Sharon. And after I met Ms. Sharon, and she wanted me to see if I could get Dr. Fred Fakorede to come on and to come on to the Wellness Zoom and explain to everyone about this critical disease that we are not aware of. And it's really I don't understand why it's not being just talked about and just being put out there in public service announcement through the CDC, but that's not happening, like Ms. Shyra said. So the church is really where we can make the biggest impact, because like everybody do go to church. So Ms. Sharon, I appreciate you, and just allowing me to be a part of this, your wellness Zoom. I appreciate Dr. Fakorede and his office and Ms. Shyra for bringing this forth. And I'm hoping that we can be in Atlanta. I'll do my best to be able to, Ms. Shyra, to advocate here. Like I promised Dr. Fakorede I would. And anyone that wants to know about the doctor here, Dr. Alabi, I'll make sure I get that information to Ms. Sharon so she can put it on, on your website or whatever, on the website of the Zoom, so everyone would know who in Atlanta can help them if need be. So
Absolutely.
I thank you.
All right. Thank you so much, Dr. Mayfield. We appreciate you. So are there any questions? We're going to open it up for questions, and go ahead and raise your hand.
Where's my hand thing?
Okay, we hear you, Bishop. Go ahead.
Okay, I was looking for my hand.
We
I'm
got you.
on my phone. This is fantastic. And Dr. Mayfield and I must talk, because I would love to know more about this. My son, he's a diabetic. As a matter of fact, he had a couple of toes amputated, so we're concerned about, his future condition. So whatever information that is that we can get, we are open, but not only him, but I like to take it to the church at large and share this information with them. So whatever I have to do to partner with you all to make this happen, I'm open to it. It may be Dr. Mayfield and I need to get together.
Absolutely.
So
Yes, sir.
Thank
That will, yes, sir. We can get together on that. As a matter of fact, Dr. Alabi already know about you, and so I just need to come and get with you on that one. Yes.
well, please do. I have several questions, but I would ask when we can get together. Okay.
Yes, sir.
Thank you for the.
Thank you.
Thank you, Bishop. We appreciate you. All right, we have Chris. You have a question, sir? Go ahead.
Yes, I would like to know if it would be possible for us to get some kind of a line link to where we could get some hard copy pamphlets, information that we could pass out. A lot of our people are not computer savvy, and they like to hold something in their hand to be able to read. Is there any way we can get some pamphlets or something like that?
Of course, I can actually email those pamphlets. Who would be the best person to email them to get those to you?
I could give you my email, but for my whole team, Sharon would probably be the best one to do that.
Okay, I have Ms. Sharon's contact information.
Okay, yeah, she would get that out to us.
I could definitely get those pamphlets out to you guys.
Thank you.
All right. Thank you so much. And also, could you put your website in the chat section, so those that might want to go and look on the website can do so? All right. Thank you, Chris. All right, Miss Susie, you have a question? And I'll take a couple more, so whoever have questions.
Oh, we have a surprise guest. There's Dr. Fakorede right there.
Hello, everyone. Good evening. Hello, everyone. How y'all doing?
Oh my
I'm
God.
so sorry. I'm so sorry. I first of all, honored to be on the call. To my sincerest apologies. I had we have a congressional hearing coming about amputations, and especially in the Black community, in April 26th. So I was on the call with congressional staffers trying to plan this event nationally. So I'm sorry about being late on the call, but just wanted to first of all thank Dr. Mayfield and the privilege of invitation to join y'all this evening. Shyra Cotton, as you met, my esteemed physician assistant, the first Black physician assistant in any outpatient lab in the country, by the way. Let's give it up to her.
Yes.
Able, capable, informed, and also just blessed to have her as part of our team. Share some information about the violent practice of amputations that have plagued especially the Black community for decades. And we're sick and tired of being sick and tired, as I tell folks. So our goal is to be out there and in all platforms to let people know about what their risks are, what that diabetes, that nicotine use, that sweet tea, that sugar, sometimes, it's good, but sometimes excessively can cause harm. And there's a lot of doctors and hospitals won't tell us what the outcomes are if we don't, regulate things early on or get screened early on. And, we live in a structurally racist healthcare system that basically has political and social determinants that have generationally caused a lot of scars. And so our objective is to make sure that we get the messaging to people, we get access to quality to people, we get the information, and we let them know what the hopes are in terms of what the options are. And when it's time to stop being polite and start asking real questions when it comes to your health. Health is wealth. So just wanted to thank y'all for the privilege of invitation. And we're definitely going to be locked in arms step to make sure that this goes out not only to all the churches that y'all recommend, but any other stakeholders that y'all think that we need to get the information to and collaborate with. Please let us know. Thank you very much.
All right. Thank you, Dr. Fakorede. We appreciate you so much dropping in on us. Thank you.
Yes, ma'am.
Oh my gosh, this is amazing. Okay, Susie, you had your hand up. You had a question, ma'am. Go ahead.
Yes, thank you guys so much for the presentation and to inform us. Did not know that this was at that level. So thank you so much. I don't live in Mississippi. I'm not in Atlanta. I'm in Illinois, St. Louis, Missouri. How do other states partner with this initiative?
That's a great question. I mean, I think how we partner, by the way, I mean, this forum is a partnership, number one. Two is you don't have to reside in Mississippi. I think what we need to do is if we have an idea as to the best way to get the messaging out to the folks that are representing those regions, because they're different stakeholders who are in different regions, and we believe in community engagement. It's hard to do so in terms of the scope and just the breadth of our team here to take that road to take that on the road is hard sometimes because we're the only clinical team here, but we need community navigators like y'all who can kind of organize a group or organize, just the large congregation that we can speak to. And then my job is to find local advocates and champions who are physicians who we trust or who are known out there in Chicago or in Illinois area or in St. Louis that want to partner to help provide access to quality care. I think that's the way to do so. There are people that we know in that region, in that regard, through industry partnerships that we've already established. But I think to say that those folks will be equally as engaging is unfair. Some of them just don't have the comfort level to speak in front of a large congregation. Some of them are not Black. Some of them are not savvy as to understanding just linguistically, how to speak. But that doesn't mean that technically, from a competence standpoint, they're not able to do their jobs. So I think we kind of, make up for their weaknesses, and we see how we can align on our strengths and bridge the gap in disparities from that standpoint. And then from a policy standpoint is to just, share whatever information there is to the group and whatever events that are coming up throughout the course of the year. Our website will carry that, and we'll be more than happy to share that content with y'all.
Thank you.
All
Yes,
right,
ma'am.
thank you for that. Doctor, why Mississippi? I mean, I saw you were from
why?
Nigeria.
Yes, ma'am. Yes,
Here in
ma'am. Is
the
this
US,
Mrs.
out of
Wilson? Yes,
all the
ma'am.
states.
Yeah, yeah. Why not Mississippi, right? It's crazy. Yeah. Because Mississippi has just been ranked at the bottom of everything. If you look at the historical context of chronic disease in this country, 40% of the population of Mississippi are Black. I'm one of the only few Black interventional cardiologists in the country who does limb salvage. If anything, I'm actually one of only 2 Black interventional cardiologists in the whole state. Mississippi ranks at the top of diabetes for decades, but it has only 7 diabetes specialists in the whole state, 7 endocrinologists. Mississippi has the lowest number of physicians per capita. Mississippi is the poorest. The folks in the Delta just have had no access to what I consider quality cardiovascular care for decades. And so it was a mission from above, to be honest. When I left Jackson, Tennessee, I was led here by the Spirit and by people who are from here to come and not only see what's on the ground and to see the despair on the ground from a healthcare standpoint, but to see what we could do in terms of bridging the gap in disparities and bring hope. And when I stayed for about 2 years, and in the same hospital that I serviced, after restoring circulation to someone's legs, a 54-year-old mechanic, a Black man, I traveled that Thursday and I came back on a Monday and they amputated his leg before I came back. When I saw that happen, I knew we had a problem. This is a health injustice issue. So just like the civil rights movement, again, inspired by Mississippi and all the work of those who we stand on their shoulders today, someone had to be their voice, someone had to be their megaphone, someone had to be their advocate, someone had to be the bull, someone had to say no. And why not me? And so I'm honored because Mississippi has changed my trajectory in terms of how I view healthcare. Mississippi has changed me as a physician. It's changed me as a doctor. It's changed me as a person. I'm a Delta. I'm an adopted Delta boy. Now I grew up in New Jersey, New York. I was a Yankee, but now I'm a Delta boy. So I'm proud of it. I'm proud to have the vast experience to be able to say, I've seen it all in terms of healthcare and in top institutions. But I'm very, when you can take care of the most vulnerable and you can do good, you can heal, you can be humanistic, and also you can meet a lot of God's people while doing so. I mean, why not Mississippi? So it's been the most rewarding journey, to be honest, of my personal and professional career.
Wow.
Yes, ma'am.
Thank you, Doctor.
Yes, ma'am.
All right. Oh, this is amazing. So just all the people that we have, if you notice, it's more than just us on this call.
Yes,
And we're a family. We're an Atomy family. We love helping people, build their immune system through our products. And so we have so many testimonies here of people that have, just have been blessed through these products. And I just want to mention Bishop Forson is I believe he's a state bishop, but he also has churches overseas as well. So,
wow. Okay.
Yes, so we're going to expand this. You're not out there by yourself. Now you're a Mississippi boy now. And so
Amen.
we're going to cover you. We're going to cover you in prayer as well.
Amen.
Because this is a journey. This is a journey. So we just thank you so much. We're just so excited. And anyone else that's on this call, if you have any questions, we're getting ready to turn it over to Uncle Mike, and he's going to come. All right. And once again, Miss Shyra, I know you're newlywed, so we got to take the cotton off and put the Marion on there.
Yeah.
It's
hard. It's hard. Professionally, right? It's one of those hard things. Especially after
we got
you've done your order, Shyra. Get it moving.
We appreciate y'all so much.
No,
and all of our leaders that are on.
Yes, ma'am. Yeah, God bless everyone and thank you very much. Appreciate it.
They're welcome.
Thank you, Dr. Fakorede.
Thank you. Thank you very much, Dr. Mayfield. Appreciate you. Thank you very much.
Awesome.
Appreciate you. Love you.
All right, bye.
Bye-bye. All right, Uncle Mike.
Okay. All right. Thank you very much. Well, wow, what a day. This has been great. We definitely want to thank Dr. Fakorede and also Mrs. Shyra and everyone else that's here. For those of you that are here for the very first time, we're really happy that you're here. Time is not on our side, so I'm going to just give you a little overview on some of the products, okay? Now, keep in mind and remember this, that God created the body, that if we give it the proper nutrients, the body can cure itself, okay? Now, we have to be aware, and one of the pictures that that Mrs. Shyra showed us was that it showed pollution and a lot of other things. There's so many things that we're dealing with that we have to supplement, okay? We couldn't eat right if we wanted to. Just like you have fake news, you got fake food. And I just read something today that there's going to be a lot more fake food coming. I'm going to do a research on part of what I read to give you more information later. So one of the reasons why I just love this company so much is because Atomy has some high quality products. Now, please be aware that there's a lot of junk that's out there. Okay, I don't think just because it came out of a health food store that is good. Okay, there's a lot of junk out there. They're more interested in their wealth than your health. So keep that in mind. So let's look at a few products very, very, very briefly. The first one is going to be Atomy's Rhodiola Milk Thistle. This is good for the liver, ladies and gentlemen. This is also going to help not only with the liver, it's also going to help with dealing with the high cholesterol and many other things as well. Another product, our #1 product, for those of you that's never heard of HemoHim or know much about HemoHim, let me tell you this one thing. Last year, this company did over $1 billion on this one product. So it must be doing something. There are several patents on it. HemoHim will build new red and white blood cells. It also helps with circulation. Okay, so if you know anyone, I told a friend of mine today, I said, if you want to prevent cancer, if you have cancer, if you had cancer, you need to be on this product. Okay, we have to give our body what it needs so that it can fight off all of those bad things that we come up against. And then we have our vitamin D3. This vitamin D3 is so unique. #1, it was delayed getting to us about 4 or 5 times in the midst of this pandemic. Okay, so finally, when it came, I was happy because I knew that it was going to be more than just vitamin D3, because that's just how Atomy works. They always come up with something. They put it together, and they put it together in a right kind of way. So this right here, it has the perfect mate, which is vitamin K2. Okay, let me see if I can briefly, because I want to show you another picture also. So vitamin K2 is the perfect mate for vitamin D3. And then on top of that, look at, they added 5 organic mushrooms. Okay, so you have 5 organic mushrooms, vitamin D3, and vitamin K2 in this one product. Ladies and gentlemen, your body is going to be thanking you. It's going to be jumping up and down inside. Your body is just happy just to have these products. Let's look at something else. Another product that we have is Atomy's Alaska E Omega-3. Vitamin E actually helps to send oxygen through the body. Okay, it helps to transfer oxygen throughout the body. So it's also good for your veins, it's good for your arteries, it's good for your heart, it's good for your joints. It puts good oil around your brain. Okay, so this product here is very, very important, and it is something that we need. And then one of our latest products is selenium husk. This here helps it kind of acts like a scrub brush, if you would, in your digestive system to help you get things moving, to get all the bad stuff out of your body. Okay, so these are some very, very important products, ladies and gentlemen. And there's many more. There's so many more that I could talk about. Let me just pull a couple up here for just a minute, because they're just so important. Here's one. It's called Atomy's 100% pure spirulina. And why is this so important? Look at this. 18 types of amino acids, 15 types of fatty acids, 13 types of minerals, 12 types of vitamins, 5 types of antioxidants. Ladies and gentlemen, let me tell you something. There are so many foods in the store that has absolutely no nutritional value to it, okay? That is why, again, we have to supplement if we want to be healthy. And we have thousands and thousands of good testimonies from everyone dealing with just about everything under the sun. So that is why these products are so important. Y'all have heard me talk about, and this will be the last one due to time, is our vitamin B complex. The complex, once again, let you know it is the family of Bs, all right? It's not just that you got people going to the doctor getting a vitamin B12 shot. I tell my friends, you're not a pin cushion. You don't need a shot. You need the family of 8 Bs. And look what Atomy did. I tell you, this company is something else. They've added 9 organic fruits and vegetables: apple, blueberry, cranberry, tomato, carrot, beet, spinach, broccoli, kale, and the list goes on. So ladies and gentlemen, I just want to encourage you. It is your body. When you wake up in the morning, when you look at that man in the mirror or that woman in the mirror, you need to ask this question: what am I doing for my health today? Because you know what? If you don't take care of your health, someone else will. And you do not want someone else practicing on your body. And that is my presentation. Back to you, Sales Master Sharon Wilson.
All right. Thank you so much, Uncle Mike. Whew, this was great, guys. Thank you so much for joining us tonight. But we're going to close out with our company motto. But if anyone have questions, I think, yes, Ms. Shyra is still on. You might have some questions I was afraid to ask because it was so many people on the call. But listen, ask your question and don't be afraid, because if we don't ask, we're not going to know. All right. So we're going to go ahead and close out with our company motto, and then we're going to have the after, what they call the after party. And so those that want to stay on can do so for a few more minutes. All right. Okay, Uncle Mike, go ahead and close us out. And thank you, everybody, once again for joining us.
Thank you.
All right. Thank you very much, Sales Master Sharon Wilson. And we want to thank all those who spoke tonight. Mrs. Shyra, thank you so much, dear. You did it. Okay,
Thank
now,
you so much.
as we get ready to do the company motto, everybody unmute your phone. Everybody unmute. Everybody unmute. And with that done, I just have one question. Company motto, are you ready?
Yes.
Hey.
Go! Cherish
Cherish
the
the spirit. Great vision.
Humility.
Vision.
Faith.
Serve humility.
Everyone.
Hey,
Great call. Great call.
thank you.
Awesome.
Awesome. Awesome. Hi, Laurie.